I'm Carolyn Scheese,
And I'm Yves Lussier.
and we're delighted to present to you a course that we worked on together. Yves said we need, so we're from the Department of Biomedical Informatics. Yves is the chair, and he said we need to be teaching AI in healthcare. So many things have happened. It's been less than 2 years since ChatGPT came out, but so much has happened. And in order for us to really stay current and for our students and for us to help prepare practitioners, we needed to make sure that we had a course. So we put this together pretty quickly.
Yeah, we have a nurse, a physician, and an engineer between the two of us.
Yeah, so we were a great team. I think I said, I can do the educational stuff and you can help do all of the other things. So we put this course together, and you know what? I think that it was a tremendous amount of fun, and I learned so much. And our students came away we got some great feedback. It was a 1-credit class that we taught for half of the semester in January of 2024. So just earlier this year, which actually to me feels like it was like 2 or 3 years ago. It feels like that because so much has changed in the field. And so we had 7 modules, and then the 8th module actually was where the students did a presentation. They worked together, small groups, and they did projects. So it was a lot of fun.
I think they wowed us, right? The projects were well above the expectations. The capability to leverage these technologies, generative AI, from diffusions and imaging to large language models, they can really jump the hoops much faster than with prior technologies. So what would take years to produce can be done in a few weeks by a group of 4 students.
It was amazing to me. We were wowed. I just wanted to show you some of these projects that they did. They created Gen AI powered chart review assistant. They created a chatbot to support clinicians prescribing patient-centered therapies. They did a proof of concept with ADHD data-driven decision-making. They also did a large language model to track and report drain lines and airways. That actually was done by some pediatricians with one of our master's students. One of the beauties of this course was we had such a diverse population. We had about 11 students in it is all. So not very many, but they were so active and such a diverse group. We had 2 pediatricians, and we had a master's student who had expertise in programming, and they were able to put together a large language model to track and report drains, lines, and airways of neonates so that they could tell if there was going to be a conflict in some of the medications that would be delivered. And sometimes, you have a big shift physiologically and they have to make a quick decision. They also did a Smart on Fire app to aid in determining compatibility as a part of that project.
Future education. Well, just yesterday we revised the course. We did expect that we had to do a lot of changes, and I'm pretty proud to say that at least half of it are new modules. So that's how fast it's changing. And the modules we're keeping, probably 50% of it will change. We'll have implemented, I guess we decided that 2 of the modules will now become more like case reports and literature review, because it's changing so fast. We hosted the largest AI in medicine conference, and the oldest one this summer in Salt Lake City. It will be 50 years when it goes back to FAMIA next year. And the ending keynote had done a review of the year of the best application in medicine, the 40 best papers, and we'll pick the best ones here to teach in our class, and those literature review in addition to the new ones that are coming out. Just to give you an idea how fast this field is moving, when Google scientists published the All You Need Is Attention seminal paper 7 years ago that led to ChatGPT and all what we know now, it has been cited 120,000 times. Now, the Human Genome paper is merely cited 20,000 times. And the next best thing in Gen AI that came out, which is AlphaFold, 9 months ago, that can now design wet drugs, protein folding overnight, which would have taken years. is cited already 18,000 times in 9 months. So that's to give you an idea of how the research is moving fast. There's at least 6 new startups funded with tens of millions of dollars in the AlphaFold area alone. And as you probably well know, in the last 5 years, there's over $60 billion of capital investment in generative AI. So
Yeah, so it's really been fascinating. We were able to do, I forgot to show you, or tell you, but we were able to have them create their own GPTs also as a part. So anyway, thank you. Appreciate it.